I talk to patients about this every day. All the therapies, diet, exercise, not smoking, weight control, blood sugar control, blood cholesterol control. Arteries are 90% of the reason men have a sexual response. Healthy arteries create a healthy sexual response. So it's all the more reason to pursue that lifestyle, which will also benefit your cardiovascular risk and maybe your actual prostate cancer outcome. And the last is there are supplements that are on, there's, of course, Cialis, Viagra, Levitra. I'll let the urologist talk about their use in prostate cancer men. But there are supplements with arginine, that is a amino acid that's in food, which is the same reason to be eating from the produce department, because that is where most arginine comes from: watermelon, arugula, pine nuts. But these can be quite beneficial. I have many men that report with a variety of arginine-based supplements, which are generally felt to be very healthy, safe and healthy, improvement in their sexual ability to perform. But as to the drugs, I'll leave that to the urology expert.
Well, fortunately, we have a lot of drugs that will improve sexual function, primarily will treat erectile dysfunction. We typically start with pills, the obvious, Viagra, Cialis, and then we can move to other therapies where we can teach you how to place a small pellet in your urethra called Muse that will allow an erection. Or a lot of what we use today in patients who've been treated is injectable therapy, where we will teach you how to use a very, very small hair-like needle and inject your penis, and that can give you a very good erection, especially if you've had surgery or radiation in that sense. And then there's finally surgery. There's penile prosthesis and other things that we could offer if you're interested. I think the key factor is that you talk to your urologist, because there's many options. If you are interested in sexual activity, there are treatments out there. It's just a matter of how far you want to go. But in this day and age, we can, it sounds, crude, but we can get the penis hard with modern medicine.
Yeah, just one cautionary point. There are a lot of companies advertising products that claim to be effective and have no science behind them. And I've had numerous conversations, as I'm sure you've had, Jason, with men come into the office and say, I've seen this advertised on TV. Is it worth it to spend my money on it? And I would just caution people to be very careful about that and go in directions in consultation with your physician so you can choose things that have some scientific basis, not somebody just trying to make a buck.
You're talking about the bipolar testosterone. This was a study of 16 patients at Johns Hopkins where they took patients with advanced prostate cancer who were on Lupron or androgen deprivation therapy, and they would pulse them with 400 milligrams of testosterone once a month. And then they would also use another drug, a etoposide, another chemotherapy agent. And this is earth-shattering. It's phase 1. It's 16 patients, so we have to be very careful. But it's very thought-provoking because what they saw, or let me back up. We use hormone therapy. We take away the testosterone because we believe testosterone feeds the cancer. Okay, and that's what causes the cancer to grow. If we take that testosterone away, the cancer will regress. So what these guys did at Hopkins in 16 patients, very exploratory preliminary trial, is they gave them back testosterone. And what they saw was that they saw PSA responses in these patients, and I think they saw radiological responses. So how does that make sense? It's a good question that has to be validated and expanded and studied in larger trials. So I would never advocate this use without a trial. But what it's thought-provoking in the sense is that if you play with the androgen receptor a little bit, take the testosterone away, and then give it back, what you'll see is changes in the disease. So I think the jury is out. It's got a cool name. It's called bipolar testosterone therapy, where it's bipolar, we give it and take it away. I think at this point I would clearly, and I'll defer to Dr. Cher as well, I would not recommend it for treatment. It has to be on a trial basis. This was only 16 patients. This is the first publication, but I think in the years to come, this will be vetted out in further trials and evaluated to see if this is worthwhile.